Good afternoon, everyone. I hope everyone today is as excited as I am, because this is my first in-person event since the pandemic has started. I'm really excited to be moderating for you today at Vision Health Pioneers. I'm Nicole Scott. I'm a journalist. I'm also a producer for a Bloomberg TV show called Beyond Innovation, and I own a German website called Mobile Geeks. Today, we're going to be hearing from 6 exciting startups, but first, we're going to be having a keynote from Daniel Kraft. He is the chairman of medicine for the University of Singularity, and he's prepared a little something for us from San Francisco. The 6 startups today will be presenting in the following order, and they each get 7 minutes with 2 minutes of Q&A. Up first, we'll have Skinuvita, followed by Breaz, ALMA, Wavy Health, a little bit of mental health with minime, and finally Karis. I strongly encourage everybody to head over to Slido. You can download the app by scanning the QR code, or if you're joining us digitally, you can go to sli.do and enter into the future in order to participate. While the startups are giving their pitch, please ask them questions, because this is kind of the interesting part beyond the pitch, and it's always nice to kind of put a little bit of pressure on them. You guys ready? So to tell us a little bit about why we're all here today and what we're doing, here are the initiators of the event, Maren and Yosha.
Thanks, Nicole, for the intro. It's actually also the first event of this kind for us. We started Vision Health Pioneers 2 years ago. I think more or less really 2 years ago we got the message from the Berlin Senate, and thanks again for the trust in us to support 40 entrepreneurs in total. The first cohort started in March 2020, 3 weeks on physical activities, and then COVID hit. And we are very grateful for everybody that supported us in the last years. It's our pleasure to stand here, representing everybody in the team, our program manager, operation manager, communications manager, everybody that made that happen. And we hope you enjoy the day.
Yes, I can only agree to what Maren says. Of course, a warm welcome also from my side to this event today. Of course, here on site, but also behind the screens at home or in your offices. I just want to take the chance to say thank you to, first of all our partners that supported us during all the time that we had in the last 2 years. Of course, also the mentors, the coaches that supported the teams on a very, very regular basis, supporting them with answering all the questions that they had, if it is legal topics, healthcare topics, IT topics, etc., etc. We are super, super grateful about this. I just want to mention one aspect here, and this is quite interesting because we've seen this over the last 2 years from our cohorts, both this cohort and the cohort before. When asking them about what really helped them and what they really liked in this program and what helped them the most, usually the answer that came most from them was that they said it's basically the network. It's the network to the people. It's the network to the partners. If it is a healthcare professional that can support them and give them some feedback about their solution, if it is an IT expert who can give some feedback about the architecture, the technical architecture, or if it is a regulatory expert, mentor, coach that we have in our network. And mostly it is not only only these regular coachings that we have and the mentor sessions that we support the team with, but also it is these small moments where someone has a good idea, has a good advice, has something good to say to the team, and has a good advice how they can move on. And this is really something that helps them, and that can also change a bit their direction where they go. So what I would really emphasize you to do today, everyone, if you see a startup today, if you have an idea for a startup, please reach out to them. If it is online, you find all their contacts online, of course, on our website. Or if it is here in the room, please contact the people, contact the startups, ask them questions, give them advice, because that is really what helps them, and that is what keeps them going for the next couple of years, and hopefully even longer than that, in order to really build solutions that make sense and that are not dying in a couple of years. So. Saying this, I very much hope you enjoy this day today. I very much hope you enjoy the pitches. And as I said, please reach out to all the teams. They are super, super open. They are super, super grateful about all your support, all your help. And having said that, I would say enjoy the evening. And
just saying, you can also pencil in there will be 3 more demo days coming, because for the next 2 years we are supporting, again, healthcare companies in 3 batches. We hope that everybody of you will support in the future as well. We don't have a date yet, but I guess same time next year, same event kind of. So pencil that in and enjoy the rest of the day here that we have. 2 hours of streaming are coming up, and 6 presentations, as Nicole said, and also some inspiration from Daniel Kraft. Some of you might have heard about him. Singularity University, they do cool shit. So that will be inspiring.
All right, enjoy it.
Enjoy.
Greetings from Northern California and Silicon Valley. It's really wonderful to be with you and have a chance to look into the future at your terrific demo day. I'm going to try and share some slides here. And what I'd like to do today as we look into the future is sort of paint a picture of what's going to be possible with the future of health and technology. And congratulations on the great work of Vision Health Pioneers in your incubator and to your 6 demo day companies. I had a look at all of them, and they're all impressive and all really helping create this future of health and medicine. I've gotten a taste of what it's like to be in Germany and Berlin. I've been there, I think, 3 times. I spoke at TEDx Berlin 7 years ago. I've been back a couple of times. Had a chance to mix it up with the startup environment there. Amazing energy and creativity. And I've been impressed as well with the foresight of Germany and its government and how it's really helping accelerate the future of medicine and digital health and beyond. So a bit of the theme of going to the future, of course, is the acceleration of technologies that are getting almost magical in their capabilities and enabling us, particularly when you bring them together, to disrupt entire fields. How we do our banking, how we get our digital entertainment have all been disrupted at the interface often of AI and big data and blockchain. And of course, all of our worlds have been disrupted this last year and a half by the terrible global pandemic. And the pandemic has often opened our eyes to, where does healthcare really exist today? Many fields have reached the 4th industrial age, but many elements of health and medicine are still stuck in the 2nd or 3rd industrial age. And I think it's our potential together to all move healthcare into this 4th age. And in a sense, who led the digital transformation of your company, the CEO, the CTO, or COVID-19? Essentially, COVID has helped shift healthcare in terms of a silver lining a little bit forward, helping us deal with not all the usual challenges, but the ones exacerbated by the pandemic, but has formed a bit of a catalyst as we move into the next waves of the pandemic to help think differently about how we address pandemic challenges, but also those across the healthcare continuum. So just like Sputnik set off a bit of a space age, COVID is sparking a bit of a new health age. And my hope is that many of the innovations that many of you are doing and your colleagues and those around the world sparked by COVID will help save many more lives than COVID has taken. So let's look into the future. When you think about the future of, let's say, a hospital, what do you think about? Is it the four walls of a hospital? I led a session with CEOs of hospital systems from around the world a few years ago, and our takeaway was that the future of the hospital really wasn't the hospital anymore. It's increasingly going to be virtual care and outside the hospital, from hospital to home or hospital to homespital, or increasingly as researchers and others were starting to collaborate from lab to laptop. So the world is shifting. But we're still in 2021 and still sometimes stuck in ways of the past. I trained in internal medicine and pediatrics at Mass General Hospital. I was back there visiting a couple months ago on the ward where I was a brand new doctor 20 years ago. And, they're still using fax machines and paper forms. And even when I had my own cardiac study done at Stanford a few months ago, I could still only get my results on a CD-ROM. I don't even own a CD-ROM player anymore. So we're still sometimes stuck using the technologies of the past, whether it's for public health or beyond. We're still often in waiting rooms, whether it's San Francisco, Berlin, or Calcutta. And we're often still thinking about how we organize our healthcare systems, whether they're hospitals, pharma companies, big tech, devices, in old silos and based on old mindsets and thinking. We used to base medicine on body parts, when today we're really in this new age of metabolic and genetic and multi-omic disease understanding. So this gives us an opportunity and a new lens to think differently as we want to really redefine healthcare from what we really practice as a sick care and really shift it to true health care. What do I mean by sick care? Well, sick care is how we've practiced medicine forever, pretty much based on very intermittent episodic data. That small amount of data is usually only collected in the four walls of the clinic, the emergency room, the ICU. It might be your corporate EKG. It might be the blood sugar or blood pressure at home that you still can't get to your doctor or nurse very easily. So that intermittent episodic data leads to our reactive sick care model. We tend to wait for the patient to show up with a heart attack or a stroke, or in my world of oncology, with late stage cancer, or we wait for the pandemic to arrive on our shores. And I think one of the big potentials of the technologies that we're talking about today, and many of you are building, is to be much more continuous with our data and to make that data information that's much more personalized, much more proactive, and can start to bring care anytime, anywhere, arguably with lower costs and better outcomes. So that's a high-level summary, I think, about the future of medicine. And as we move the needle in not just better ways of treating disease and preventing disease, we also have new markets and opportunities to optimize our health and wellness, not just to live long lives with long lifespan. No one wants to be 120 and feel 120. We want to start to optimize our health spans as well. So huge opportunity moving forward, and certainly particularly in the setting of the pandemic and in accelerators like yours, the future of medicine is on our mindset. I was lucky to write the opening article for National Geographic about 2 years ago, a whole episode about the future of medicine. And it really wasn't about 12 innovations or 50 innovations. It's about how these innovations are coming together and converging to enable us to do things differently. And many of these innovations, of course, are riding exponential trends. Technologies are accelerating and doubling in their power and lowering in price every 2 years. It's easy for us to think linearly. 30 linear steps, I'll be across the room. 30 exponential steps, I'll be at 1 billion steps. That would be 26 times around the planet. And we're all familiar with exponential technologies, those of Moore's law embedded in our supercomputers in our pocket, which is why the processing speed from 1985 is up billionfold in the last 20, 30 years. But with exponentials, it's sometimes hard to understand and appreciate the pace and acceleration of change. We often underestimate what's going to be possible in, let's say, the next 10 years. The last 10 years were pretty amazing. I think the next 10 years will make the last 10 years look slow. And we've all seen examples. Some of us grew up in the pre-digital age. All these technologies, of course, have been appified and digitized. And in this digital age, it means technologies that used to be physical, whether it's a GPS or a EKG machine or an ultrasound, can be dematerialized, demonetized, essentially free and democratized around the planet. So that gives us all this opportunity to reimagine healthcare. What we can do today, and again, what's going to be possible in the next 5 and 10 years is going to be quite incredible if we all work together collaboratively. So of course, one of the themes of exponentials, of course, is the magical smartphone, which is now able to do everything from diagnosing ear infections to listening to your heart. We're sort of medicalizing the smartphone. And on this exponential trend, what used to fit on your desktop computer 20 years ago now fits on an FDA-cleared medical device in your smartwatch. And this kind of incredible convergence gives us opportunity to, again, think differently about how we can manage health and prevention, how we can diagnose disease early, how therapy, whether it's an app or a drug or a device or a combination, can be done in much more smart, data-driven ways. And even discovery, how do we run clinical trials in faster, more effective ways? So part of this new era, of course, is increasing transparency. Each of us on our mobile phones now can compare one hospital to another, rate our doctors, rate our nurses, compare drug prices at different pharmacies. In the United States, we have something called surgical scorecard. You can look at individual surgeons and their complication rates. So the consumer has a lot new power. And we're all leveraging new data from our expanding Internet of Medical Things, now riding 5G and soon maybe 6G, 1,000 times faster than 4G. And that gives us both power and challenges. All this new exponential data is often siloed, doesn't easily talk to each other, whether it's your genetic sequencing information, scheduling information, digital exhaust information. So what we need to do is not just think about creating more data, we need more knowledge. We need to go from data sets to actionable information and insights that you can use as an individual or patient, or I or your doctor can use as a clinician, and narrow the gap between understanding the knowledge and the insights to what can be used at the clinic, at the point of care, or on web connection with not just bedside manner, but better website manner. Now, technology, of course, is only a piece of the equation. We know that we have to align the incentives, and sometimes the incentives are misaligned. We have, in many parts of the world, still fee-for-service medicine. In Germany and NHS and even Kaiser and the VA in the United States, we'd have more value-based care. We're paying for better outcomes. And we're also starting to reward and pay for care that happens outside of the four walls, from hospital to home to phone to on and even inside our bodies, or care that's starting to happen at our corner pharmacies, where they're starting to battle it out with their primary care doctor, or increasingly through virtual care. So all of this kind of brings us to this new age of connected health, mobile health, digital health. I think we'll just soon call it health, but it gives us the opportunity to match the data sets with the individual or the user. It could be a nurse, a hospital system, a pharma company, to match the data and the data sources so we can really make this information useful and move the needle. 10 years ago, I gave a TED Talk, Medicine's Future. There's an app for that. There were about 35,000 apps 10 years ago. Now there are over 350,000 apps. How do we make sense of them? How do we match them? And to the credit, I know in Germany, you have the DIGA system that's starting to make waves in terms of starting to enable prescribing and paying for applications when they work and have evidence behind them. So great leadership in Germany, which I hope will spread around the world. Now, of course, digital health by itself is not a panacea. We need to study these tests, these applications, to make sure they work, to make sure they're integrated, make sure they're rewarded and the incentives are aligned. And of course, it's not just digital alone, it's the things that can ride on top of that, from AI to virtual reality to 3D printing to nanotech to blockchain, all converging, super converging, which enables us the opportunity to even create entire new fields. These are fields that didn't even exist when I was a Stanford medical student. AI meets radiology, robotic surgery, designer antibodies. All these new fields give us opportunity to think differently about addressing the big challenges we have in healthcare around the world, from rising costs, aging population, how we make sense of the data, to even how our regulators and insurance companies help pay for these new technologies. Now, as we move into this future, we need to think differently about not just technology, but of course the social determinants. We're now aware, of course, that our zip code in many cases is more important than our genetic code in terms of our lifespan or health span. And at least in the United States, social disparities have played a big role in who gets COVID, for example, and who has died from it. So we need to pay attention to our often core needs, whether it's clean water, education, vaccines. And of course, in our digital age, we have new needs, from Wi-Fi to, of course, battery life. So think about the digital determinants of health as well. Do your patients have access to internet, electronic devices, and the ability to understand and use them as well? And with new elements like Starlink, we're going to have internet access opening for the 50% of the planet that does not have internet access today. So huge new markets are opening up with the democratization of data, connection, and information. So now we all have the opportunity to reimagine parts of healthcare. Of course, Uber is an example of an exponential company. They didn't invent the smartphone or GPS or online payments. They connected the dots. It was quite disruptive to the taxi drivers. I remember there were strikes even in Berlin. But we're all now, in a sense, trying to Uberize healthcare, to make things easier, to press a button and bring a doctor or nurse to you, or your drugs delivered by an Uber or Lyft. We're seeing examples from other countries like China. Ping An's Good Doctor. I think they're now over almost 300 million users, really doing health and medicine in new blended and digital ways that are really changing the game for many folks across China who had almost no access to healthcare in the past. We're seeing the Amazons and the Googles and the Facebooks and the Microsofts get into healthcare, disrupting how we deliver care in this blended virtual and analog model. And of course, companies like Amazon even getting into the pharmacy space in the United States, quite disruptive to other players. And it might not be science fiction that soon our drugs are delivered at the press of a button by drone. In fact, just this last year, the first FDA or FAA cleared drone delivery was approved in the United States, already happening in Switzerland and Africa. So sometimes the future is coming faster than we think. I was at the HIMSS conference a couple weeks ago. I even saw a dermatology company using a drone to fly around a patient and take pictures of their skin. So lots of convergence happening. So the bottom line is many fields have been disrupted. Many entire industries have gone poof, particularly when exponential technologies are being applied. No one wants to be the next Blackberry or Blockbuster or Kodak. You essentially want to be thinking forward. You want to be Ubering yourself before you get Kodak. And that opportunity is coming across healthcare. I've been looking at this convergence for several years. I chair medicine for Singularity University, and I've founded and run a program called Exponential Medicine, where the theme is breaking up silos, bringing people from all sorts of fields together, whether it's the Craig Venters who did the first sequencing, to Stefan Bancel, who was the CEO of Moderna, to Jen Goldsack, leading the Digital Medical Society. It's at the interface of new ideas and new technologies and people that things can happen. Though sometimes it's not about the technology, it's about our mindsets. I love this quote shared by the head of NHS Innovation. The difficulty lies not in the new ideas, but in escaping from the old ones. So many of you are creating new ideas, but how do you help the folks with the old ideas let the new ones in? That's one of the biggest challenges. In the United States, even the FDA is opening their minds to new challenges. To their credit, they've now created new platforms for digital health, software as a medical device, and they're starting to really fast track new innovations in smarter, better ways. Okay, let's look at 3 areas and how they're moving into the future. Let's start with health and prevention. We'd rather stay healthy than treat disease. And we know most of our diseases are manifested by many of our bad behaviors. And now we're in an era, only for the last 10 or 12 years, where you can start to measure your behaviors. The first Fitbit only launched, 11 years ago, 12 years ago. And now most of us are wearing some form of connected wearable device. I'm wearing like 4 right now, my Oura Ring, my Fitbit, my Apple Watch, and something in my underwear. And what's interesting about these sort of wearables is they can start to measure almost every element of our physiology and behavior, and can start to give us really interesting information. Sometimes it can just be small data. You send a patient home from the hospital after a COVID infection or after a total hip replacement. Are they walking more? Or are they walking less? If they're walking less, something's going on. Maybe we can intervene and prevent a fall or a complication. And then, of course, beyond wearables, we have inside-ables, contact lenses with sensors, trainables, and this kind of convergence gives us not the ability just to measure for ourselves, often quantified self, where the data is stuck on your own smartphone, but it's starting to shift us to quantified health. Well, that data, those digital biomarkers, will start to flow to our healthcare providers to optimize wellness, to diagnose disease early at stage 0. And then if you have a common or non-common disease, to treat that disease with much smarter feedback loops to optimize treatment going forward. And lots of things we can now connect on our age. Blood pressure is coming to our smartwatches. So soon we'll have 24/7 blood pressure just from a wearable, maybe even your blood sugar as well. We also have inside-ables coming, sensors that are going to be underneath our skin that can transmit data 24/7, which might be part of chronic disease management for many of our patients. We've gone to shockables, which can change behavior. Hearables, which don't just play music, but can track our physiology and give us coaching and guidance. And, ringables, like the Oura Ring I'm wearing, an incredible amount of exponential technology shrunk into a ring that can track sleep and beyond. And if those of you listening do nothing else with quantified self, find some technology to start tracking your sleep. It has such an implication for staying healthy and preventing disease or helping manage it going forward. Other forms of technology are, breathables, sensors that can measure the biomarkers in your breath and pick up everything from cancer to COVID. Sockables, technologies that are woven into our clothing now that can pick up signs of early diabetic ulcers in a patient who can't feel their feet. Stretchables are coming that will measure our physiology. Wearables for pain, even devices that can start to track our brain health by enabling eye tracking on our mobile devices. And electricity is medicine. Wearables that can take a patient with a tremor, for example, with Parkinson's or essential tremor. And this wearable uses electricity as medicine. It can start to reverse out the tremor and enable her to have much better function and better quality of life. So let's not look at wearables as just forms of sensing, but also forms of therapy going forward. One of my favorite now is under wearables, little sensors like this, Internet of Medical Things. You get a pack of 10 of them. And with new reimbursement codes for remote patient monitoring, companies like Spire are now giving you a pack of 10 of these. You can put one on every pair of underwear. They last for a year. They connect to your smartphone, and you can measure respiratory status and do that remotely and hopefully keep patients with pneumonia, COPD, or COVID out of trouble. Other wearables are coming for someone who might be paralyzed, not able to walk well, so exoskeleton type technologies, or even wearables, the ultimate wearable, I love these as a pilot, are being pioneered in Switzerland to see if jet suits can be used to help rescue folks in the distant mountains. I got a chance to try flying one of these myself. It's a little harder than it looks. Then another thing we start to measure and quantify is our food. Food is medicine. Famous quote from Hippocrates, let food be thy medicine, medicine be thy food. Now we can quantify our input from our diet and start to measure our output as well. Not so sexy, but lots of data there. We can even start to enter this new age of metabolomics, where with low-cost sensors, we can, even if you're not a diabetic, start to track and understand how your metabolism is affected by different medications. And I think we're moving into this era of sort of digital AI-powered nutritionists that can really start to optimize based on your genome, your microbiome, your metabolome, instead of one-size-fits-all diets that really match you as an individual. And then, of course, we can have sensing through invisibles. Our cameras now can pick up our vital signs, everything from blood pressure to maybe our blood sugar by camera. This is going to really start to change the game of collecting seamlessly without having to wear anything. That'd be helpful for tracking older patients at home. Are they upright? Are they healthy? Definitely some privacy issues there, but new ways of connecting and understanding what's happening. Voice is another form of invisible biomarker. Voice can predict neurologic disorders, mental health elements. It can listen to the sound of your cough and determine is that a common cold or COVID or a croup. And I think tremendous potential to collect data there, even with our smart speakers, which are able now to pick up heart rate from multiple patients, or Wi-Fi, which has been modified by engineers at MIT to measure the digital biomarkers from 10 plus patients in the same household. So tremendous opportunities now to collect our digital exhaust. The question is, what do we do with it? That's a lot of data. Who owns that information? Does the doctor even want that information? This is a cartoon from Exponential Medicine. What is it, doc? And it says, just as I thought, you're generating too much data. The doctor, the patient, doesn't want the data, they want the insights. So as you're designing new technologies, you want to think about the workflow so it's not overwhelming and burning out the doctor, the nurse, the pharmacist with having a tight medical records, integrating that into the smartly designed workflow to improve the clinician experience, not just the patient experience and outcome. Now, this is starting to come together now. We can start to integrate data from our smart devices. Platforms like Verily's baseline trial are studying the digital exhaust and the other elements from thousands of volunteers. So we'll start to make sense of this information. I like to call it predictalytics, integrating multiple streams of data so that each of us and each of our patients has a bit of a check engine light, integrating from sometimes dozens or hundreds of different sensors so that we can be proactive before someone has the fall or has the heart attack or stroke. And we're seeing examples of our wearables being able to do this. Wearables can start to pick up the flu or maybe even patients who have COVID while they're asymptomatic. And so that will bring us to an age when we get early warning. When that check engine light goes on, you can do something proactive. And maybe when you're walking into a room, you can determine who to shake hands with or not shake hands with in terms of infectious disease risks. Now, of course, all this data is great, but it's really hard to do behavior change. And we're seeing new abilities to do virtual coaching with a human on the other side of the phone or an avatar. This ability to bring data together, coaching, is really changing the game. And in many cases, it doesn't matter that the coach isn't real. These avatars can feel more and more real. Patients interact with them and respond similarly. So think about the coaching elements, not just providing data. And that data can be presented in ways that really match the individual. Because you can't just have one-size-fits-all technology. You want our patients included and engaged. You need smart design thinking, very different from a Gen Y or Gen Xer who's on Snapchat than a baby boomer who wants different forms of interface with their health information and how they communicate that with their healthcare teams. Of course, voice is providing a platform now to make it easier to communicate, whether you're in the home or the operating room. Imagine we each have a personal digital health coach that learns us, presents data and information in ways that incentivize us. It doesn't show us you of today. It might show us you of tomorrow, if you're improving or not improving. So new ways of seeing our futures. And of course, that brings us to one of my favorite technology areas, this convergence of augmented, virtual, and extended reality, the ability to now layer information into our everyday lives, or starting with the surgeon today, who can start to see through their patients and do smarter, more guided interventions. It can come to educating our patients when they can use a virtual reality t-shirt, and kids can start to learn about their basic anatomy. Here's my son, Leo, learning his basic anatomy when he's 3. That can change his entire perception of health going forward. And then, of course, there's virtual reality. It's great for playing games. I've got my very low-cost VR headset here. They're amazingly powerful now, low-cost technologies. But VR can be used for therapy. It can be used for treating pain patients. They go into cold rooms and throw snowballs. It can be used for doing better physical therapy to get patients engaged in PT. It can be engaged for exercise. I spent 100 days straight during an early pandemic in this virtual reality environment every day doing a virtual reality workout. So incredibly new ways to use VR. Particularly relevant, I think, is for medical education, where we can use these technologies as medical students or nursing students or patients ourselves to walk through our heart or a patient's heart and understand the physiology, what the therapy might be. Tremendous new ways to change medical education. Or video games for doctors. Essentially, flight simulators essentially are coming. Instead of see one, do one, teach one, all of us will start to get trained in simulators, in this case, virtual reality, to train for new procedures, practice them, make mistakes before you practice on a patient. Now, this will come together to help guide our clinicians. I like to call it a Waze or Google Maps for clinicians, where you'll be guided step by step through procedures. And it won't become necessarily fully autonomous, but we'll move from driver assist to surgical assist to nurse assist, layering AI machine learning on our healthcare journeys. Let's switch in the last few minutes to diagnostics and therapy. Diagnostics is increasingly getting powerful. I had a full body MRI. I got my full body scanned in less than an hour. Incredible data came back to me that was useful. Less than an hour later, the radiologist was helped with some AI reading. The scanners themselves are getting smaller and more mobile, so we'll see mobile MRI machines. I think in a few years, we'll see basically scans that you can get at your corner pharmacy for under 100 pounds and for under 10 minutes that might give us full body scans and proactive information. And then, of course, we have all these new digital tools that can fit in our pockets and give us essentially a digital doctor's bag. Here's a picture of some of the devices on my desk right now. What's interesting about these is they can blend with telemedicine. You're not just talking to the doctor or nurse. They can be doing, the patient themselves can be doing diagnostic, or a family member can leverage these diagnostic tools anywhere. From technologies like the Echo stethoscope that can combine AI stethoscope with an EKG, all the way now to low-cost digital and powered and AI-powered ultrasound devices that can really democratize where diagnostics can be done around the world. And of course, also the laboratory on a chip is becoming democratized. Microfluidics is bring a laboratory that can integrate with your smartphone, or your smartphone camera can do sort of a medical selfie. You take a picture of your urinalysis sticks, so instead of taking the urine to the lab, take a picture. This is a company called Healthy.io. I'm on their board, and incredibly bring that data right to the doctor, to the patient, to the pharmacy right away seamlessly. They're also doing that for wound care using, again, the camera and the powered AI and machine learning. And with the needs of this pandemic, I've been chairing the XPRIZE Pandemic Alliance Task Force. We ran a $6 million XPRIZE to create new testing that was fast, frequent, cheap, and easy. 700 teams entered that competition. We ended up with some incredible new evolutions for better COVID testing, which later will translate to testing for other infectious and non-infectious diseases. So the power of competition. Okay, so now we have all this data coming at us, particularly as doctors and healthcare providers. How do we make sense of it? Of course, now we're in the age of AI, or I like to call it IA, intelligence augmentation, where you can augment your own ability to look at that skin lesion and determine, is that a melanoma or a mole? We can start to leverage, of course, AI to help the radiologist find lesions they might have missed. It's coming to digital pathology, and AI is even coming to gastroenterology, where doing your colonoscopy, they can find a lesion that the doctor might have missed during the procedure. And we're going to bring AI machine learning into the hospital setting to predict who might be at risk for sepsis or a fall or a wound infection. So power of data applied appropriately can really change the game and prevent problems before they even happen. And part of this is coming through this modeling, this idea of a digital twin, where we can start to model and predict what's going to happen based on all this information. Now, this doesn't mean a competition between human and machine. We still need human compassion, human connection. It's more of a collaboration going forward. So as we move into this era, you need to think about not AI replacing your doctor, but the doctor using AI replacing those who don't, or the pharma company using AI, or the payer, et cetera. Okay, Let's finish up quickly with therapy. Lots happening in therapy from, well, again, electricity is medicine, pacemakers for the brain, pacemakers to treat sleep apnea, even for remote control contraception. We need to understand who can own that data, who might hack that data, and even use other technologies like blockchain to play a role in helping us share and keep data private and shareable. And then, of course, telemedicine has exploded on the scene. Telemedicine in the future is not just going to be talking to a screen to the doctor, but increasingly starting to use chatbots to do early screening. Platforms like Ada Health and Sydney Care and Sensely have a communication with the patient before they get up-leveled to the doctor or go to the hospital. Digital mental health, of course, is becoming more and more important, and digital platforms are enabling very powerful ways to treat depression, anxiety, even PTSD. So part of this new future is prescribing an app. Prescribing an app for smoking cessation, for mental health, for cancer care, even as one of the startups in your cohort is doing, video games to treat ADHD instead of a drug. Now, the problem is there's so many of these new applications and solutions. How do we make sense of it? I know you have some good ones in the German platform. I've been building a new resource called digital.health. That's the platform. As a resource, a platform to understand what technologies are out there that you can find and prescribe, let's say as a clinician. It might be a diagnostic device or an app. And we'll soon be launching this new version of digital.health. Please come check us out, sign up. You'll get the launch this fall as a real platform to find and discover and even feature your own companies and solutions going forward so others can find and match the digital health and other solutions that their patients need. Let me close with discovery, right? We might have the best new drug or app, but unless we can speed up clinical trials, it can take too long to get these to market. So we're seeing this new era of digital meets sensors, meets connected data, meets AI to really speed up how we do clinical trials. This idea of a virtual clinical trial has certainly been accelerated during COVID. So I encourage you to think about how do you get the evidence in new ways going forward and make it easy for anyone to download the app, download the trial, maybe you ship the drug, maybe you ship the device, and make new solutions come to market faster. So in a sense, we start to then crowdsource this future of medicine, just like we crowdsourced our driving with Google Maps or Waze. Here's a map of Rome built in a day, but we can start to think about our healthcare journey, sharing our health information so we can find and help other patients like us or patients like ours as we move through healthcare challenges and pathways. So we can think of ourselves not just as organ donors or as blood donors, but as data donors going forward. And a great example of a startup doing that and actually building a Waze for health is one called Stuff That Works out of Israel, where you as a patient with any sort of problem can share your medical condition, combine that with millions of other patients and glean the insights of what might work for type 2 diabetic or someone with migraines or psoriasis. I think that's going to be part of our crowdsourced future of health and medicine. So in conclusion, I think this future of health and medicine is bright. It's not about any one technology, but how these technologies converge and come together and are integrated in smart, powerful ways, and not just where the technologies are today, but where they're moving. And if we take that exponential convergent mindset, we can move from our era today of reactive, one-size-fits-all sick care to one that's proactive, personalized, crowdsourced, and democratized. So don't just think about what's possible here in 2021. 2021 used to be the future, but skate to where the puck will be, as the famous hockey player Wayne Gretzky said. Skate to where the technology will be with AI, robotics, 3D printing, nanotech, genomics, blockchain, et cetera. And given that exponential and accelerating mindset, we have an opportunity not to take incremental steps, but exponential ones. In many cases, the future's already here. You're building it. It's just not evenly distributed. And it's up to all of us, particularly those of us listening in the room and creating technologies and new solutions in Germany and beyond, not just to be the ones predicting the future, but to collaboratively, boldly together, create that future of health and medicine for a better health around the planet for all of us. So with that, Dankeschön, thank you for your time and attention. I'm happy to connect with anybody online. If you're looking for funding, I'm connected to many funding sources. Check out digital.health as well, and let's create the future together. Thanks.
So that was Dr. Daniel Kraft from San Francisco and the University of Singularity. I bet you can't help but being excited about the future of digitalizing healthcare and digital health and health medicine. And a lot of the topics that he brought up are things that we're actually going to be hearing about today. Democratizing diagnosis, prescribing an app instead of drugs, Maybe even using gaming to solve ADHD. A lot of these topics that we're going to be hearing from our 6 startups that are coming up are things that he embodied in his presentation, things about how we want to envision the future together. So, you guys ready? I'm excited. Okay. So we're going to be starting with our first startup. But if you guys haven't downloaded the Slido app, you can sli.do, and then it's into the future in order to participate. So please ask the startups questions, because then otherwise I'll be asking the questions and mine are pretty tough. So maybe you guys want to be kind. So sli.do, and then into the future is what you search in order to participate. So the very first startup that we're going to be hearing from is Skinuvita. They are looking to make chronic disease a little more manageable from home through UV light therapy. Jan, welcome to the stage.
Thank you very much. Thank you. Hello, my name is Jan Elsner, and I'm from Skinuvita. We make UV therapy accessible. In Europe, there are over 56 million people suffering from a skin-related autoimmune disease. This includes psoriasis, atopic dermatitis, vitiligo, and many more. Actually, I'm a patient myself. Having such a disease doesn't really feel good, and you look different, which is not always easy to deal with. And unfortunately, there is no cure. But there is a therapy that can significantly improve the symptoms. UV therapy. It's highly effective, has over 30 years of clinical evidence, and comes with a good cost-benefit ratio. There's just one core problem: the high time effort. A usual treatment cycle involves 30 sessions, ideally 3 to 6 every week, and each single time you have to drive to the dermatologist during opening hours, which often clash with other duties in life. Basically, this treatment is not accessible for anyone who has a normal job, who has to take care of kids, who lives in a rural area, or who is limited in mobility. A solution for those patients would be home treatment, which is possible according to the medical guidelines, but the technical status quo doesn't fulfill the safety requirements for prescription. We changed this with our solution approach, which is co-developed with the leading dermatologists in Germany. Basically, there are 3 challenges to make UV home therapy safe. There needs to be monitoring for dermatologists, guidance for patients, and a prevention of the misusage of therapy devices. Here's how we solved it. First, we have our therapy manager for dermatologists, which allows an easy creation and adaptation of dosage plans based on the parameters from the medical guidelines. The treatment plan gets transferred to our patient app, which guides through the therapy and involves safety checks before each single session. Finally, we have our Bluetooth control unit, which is connectable with therapy devices from different manufacturers, making them smart and allowing an automatic dosage transfer. 24 hours after a session, the patient will provide a feedback how the skin reacted to the treatment. This is important in order for the dermatologist to evaluate if the dosage plan needs to be adapted or not. And thanks to implemented algorithms, we will be able to calculate the probability of a side effect even before it occurs, making the treatment more safe and more efficient. We already did first prototype tests, and as you can see, the results are very promising. So our business model has 2 core revenue streams, which are covered by the health insurance. A dermatologist can either prescribe our therapy app together with a compatible partner device for the duration of 90 days. In this case, they do the supervision themselves. Or they transfer their patients to our virtual clinic, where we provide not only the software and the partner device, but also the telemedical supervision done with our collaboration partners. Looking at the competitive landscape, we have to compare UV therapy with conventional system therapy and biologics. The big benefit of UV therapy is its great tolerance in combination with high effectiveness, and we will be able to provide our therapy at significantly lower costs. And this leads to a win-win situation. Health insurances benefit from big savings in treatment costs, while dermatologists benefit from more flexibility and improved processes. And patients like me benefit from more life quality, thanks to an effective treatment which is compatible to their daily life. So there are 56 million patients in Europe suffering from a skin-related autoimmune disease. Not for all of them UV therapy is recommended. This is the case for 26 million patients. And we plan to do our market entry in the German market, where we can reach 1.4 million patients. The market size itself, it's about 250 billion euros every year. We are a strong team on a supportable mission, ranging from IT to design, business, public health, and medicine, including a leading dermatologist. Together, by the end of this year, we will have all technical functionalities implemented. We will then go into CE Class 2A certification, launch within selective contracts, and then apply for the DIGA fast-track approach. We will then extend our technology to other therapy fields. And you can help us to achieve these goals, as we're looking for dermatologists and patients for usability tests, we're looking for health insurances for pilot projects, and we're looking for investors for our seed funding round. So if you're interested, feel free to get in touch with us, and I'm very looking forward to your questions. Thank you very much.
So Jan, let's dive right in. So how are people getting the feedback that you mentioned about the diseases?
So there will be different development stages. The first stage will be based on scales. So for instance, how is the redness of the skin, how is the itchiness, maybe some pain. The next stage is to take some photos, and the next development level would be also to have a video consultation with the dermatologist. However, we plan to do most of the technologies asynchronous, so that the dermatologist has the flexibility to do it whenever they have the free capacity in the office.
And how exactly does that work? So, could I just turn up the treatment because I think more is better?
Well, that's basically the logic of our Bluetooth control unit. If you're a patient, sometimes you really want to boost a little bit the therapy process, or maybe you have a slip and put accidentally in the wrong doses, and basically this shouldn't be possible because there's a good reason for the treatment plan. So this is why we have the automatic transfer of the doses, because yeah, it should be there, and it's not, and that's basically one of our incentives.
And so can you talk about any security concerns for using this product at home?
Security.
Yeah, security concerns for using it at home.
Yeah, so basically one is the doses transfer. So usually a patient gets a treatment plan, and the doses has to be put into the device, which I already kind of covered. The other thing is, what happens if the prescribed doses doesn't really work? Then the doses plan needs to be adapted. But this is currently not possible because the treatment plan is on a sheet of paper, and the dermatologist cannot have a look at it. That's why we have the patient app, where the feedback can be seen in the end from the dermatologist in order to evaluate if it needs to be adapted or not.
And so you're actually making a hardware device. This is fairly difficult because it's also a medical device that needs certification. Can you talk about the manufacturing process and how you're planning on getting that certification?
Yeah, so well, the lamps and the devices themselves already exist since, I don't know, 30 years. The problem is the control unit. So we're not entirely reinventing the wheel, but we're developing the control unit, and we do this together with the manufacturers. We already have first partnerships. There is a really good win-win situation because the manufacturers have competence in manufacturing and technical design, while we bring all the digital side into it, and like this we can both benefit from the home treatment market.
Perfect. Thanks very much. Thank you. So again, please join us on Slido, sli.do, into the future in order to ask any questions. Up next, we have Breaz. So I think over the last 2 years, we've all thought about respiratory health more than the previous 20 in my life. And I think that there is a lot of concern for how we're going to be treating respiratory diseases in the future, and exactly about how we're going to be democratizing the diagnostic process. So Breaz is taking a maybe old school or kind of tried and true method of diagnostics, but they're modernizing it and digitizing it. So let's welcome James and Petra to the stage.
I'm James, and this is Petra. We're co-founders of Breaz, and we're developing a medical device to detect and monitor chronic respiratory diseases. We want it to be as easy or easier than measuring blood pressure at a doctor's, pharmacist's, or even at home. This year, we've all been aware of how COVID-19 has affected our lives. But apart from acute diseases like corona, there are chronic breathing diseases which affect 1 billion people and actually kill more people than COVID every single year. But to many, these diseases remain invisible. To tackle this problem, we've put together a team of scientists and engineers from world-leading institutions. We have Petra from Max Planck, Eduardo from the Politecnico di Milano, myself, James, from Cambridge. We've also partnered with leading respiratory experts and hospitals to make sure we're creating a clinically useful solution. This is me in a hospital in Barcelona, where we were searching for unmet clinical needs in the respiratory department. I was shocked to see how people suffering from breathing diseases like COPD cope every day. They require frequent hospitalizations, oxygen therapy, and they have a constant struggle to breathe. Early detection and monitoring of this disease is crucial to prevent this sad outcome. In the hospital, in the lung function lab, I saw how this testing is currently done. It revolves around a test called spirometry. Now, this test hasn't actually changed much since the 19th century and goes a little something like this.
Go, 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 go.
It's exhausting to do, and hard to get a good result, even when you have a nurse yelling at you. The test has to be repeated and repeated, and even then, it's hard. In rural settings or in primary care, where there's limited resources, this leads to a huge misdiagnosis of the disease. Our solution is a hardware tool which is both sensitive and accurate, and is suitable for the screening, diagnosis, and monitoring of chronic respiratory diseases. All the patient has to do is breathe normally into the device.
That's it.
It's comfortable and easy to perform, and can be used by a specialist as well as a non-specialist. And importantly, it gives comprehensive and intuitive results. This allows us to reduce this misdiagnosis. We're not trying to reinvent the wheel here, and we're basing our technology on an existing clinically validated technology. To that technology, we add new sensors and are reinterpreting it using machine learning, trained by lung specialists.
Whereas our competitors are focused on the specialized sector, assessing individual properties of lung health, we provide a simple and holistic assessment that can be used in any environment. It's like having a lung expert right next to you. Our solution will be accessible through a subscription-based model. We also offer a premium platform for those patients that need regular testing and follow-up. The subscription model reduces the barrier to market entry in primary care, something our competitors suffer from. This allows us to reach both outpatient and hospital sector. Our first market will be in Spain, which offers a centralized healthcare system and already has a strong focus on COPD prevention. By creating trust and medical awareness, we aim to enter clinical guidelines, which is led by one of our mentors. Our solution saves valuable time to healthcare providers and long-term cost savings to insurers. Every case diagnosed early on will save more than 30,000 euros over a patient's lifetime. Our journey started 2 years ago. We've participated in prestigious incubators and been awarded international prizes. We also have applied successfully for public funding and been awarded more than 200,000 euros to push our product development. We are currently developing our functional demonstrator, which will be ready by the beginning of next year to collect big data in our partner hospital in Barcelona. After the successful clinical trials, we will be on the market in 2024. We are currently looking for private investors to support our public funding, and also clinical experts interested in validating our concept.
Our solution started in a hospital from a real clinical need.
Now we are shining light on respiratory diagnostics. We're making lung testing a breeze.
Thank you very much. Let's just dive right in. Can you talk about some of the other respiratory diseases this might address?
Right, this can be useful for a range of respiratory diseases. We're starting with COPD because of the huge impact it has on patients' lives. But for example, with COVID and post-COVID, especially long COVID, this is a kind of chronic disease in the end. And this is something which our device could be useful for monitoring over time.
And you're beginning in Spain. Can you talk about getting your headset on properly. And what's this going to be like to move across international borders with Breaz?
So the way that the device is designed, it should be used in many settings. I mean, even in developing countries, I think we see a great value there. We also see the digital integration is key. So I think that is a part that then will adapt definitely to the setting or the country we enter.
And what are the reimbursement paths that would incentivize doctors and hospitals to buy Breaz?
So our initial technology can already be reimbursed under existing reimbursement codes, and that's important because it means it can be used straight away. And that's because we're building our device from already clinically validated base technology, and then we're adding value on top of that test. So that, yeah.
And then just in under 30 seconds, can you talk about the difficulties of manufacturing a physical hardware device and how you plan on tackling this for broad international distribution?
Exactly. Manufacturing is a very difficult process, especially for a medical device, and there's lots of regulation to follow. We want to do our manufacturing with a contract manufacturer inside the European Union, which enables us to follow the regulation more closely and also allows us to be right in connection as we're developing the device and make adjustments as necessary.
Perfect. Thank you so much, guys. James, Petra from Breaz. So, up next, we have ALMA, who is a startup that's focused on removing the stigma around female health issues. And it's really nice to see such a female-focused startup stem from design and not necessarily from tech. So seeing this kind of convergence of where innovation happens, I feel it's always a little bit more interesting when two separate fields come together. So, Julia from ALMA.
Hello everyone, and thank you for being here. I'm Giulia, co-founder at ALMA, a social enterprise whose mission is to combine design, technology, and anthropology to co-create a cultural change in female intimate care. So we are developing ALMA Atlas, an online community platform which captures what it means to live in a female body. So female health has long been considered a taboo subject, from endometriosis to vaginal infection, going untreated and undiagnosed. But why? There are a multitude of cultural and social stigmas which affect millions of females worldwide, leading to fear, shame, and to a culture of silence. So I want to introduce you to Flora, a female who suffers from yeast infection. And besides being an incredible common condition, understanding her symptoms and accepting treatment can be rather confusing and frustrating. So Flora, before going to a doctor, she will search online to understand what her symptoms means. But too often, medical websites are generic or full of incomprehensible jargon. So she will reach out to her female friends to talk about their experiences, but not all of them are comfortable to talk about their vagina. So then she will reach out to the doctor to actually search for an advice, but not every female has access to health care. And eventually, after the misuse of antibiotics, the next time she will go for natural remedies. So as you can see, after so many obstacles, Flora is actually left alone. So how can we help? ALMA Atlas is an online community platform that provides a safe and inclusive space for every people around the world to share their personal experiences surrounding female intimate care. So while co-creating knowledge, just like Wikipedia, the community will have access to educational resources and telemedicine services. Over the past 2 years, we have been working and collaborating with governmental organizations, which actually help us to connect with females, create a dialogue, validate the atlas, and co-create a knowledge of trust, care, and knowledge sharing. So here I would like to give you a glimpse of the workshop that we have been running from Brazil, Thailand, Malaysia, and Europe.
What is about Thailand is still very basic.
An opportunity to help young women learn how to listen to their bodies. I certainly didn't learn it. I've learned it as I got older. So instead of the pains and the change in the body being something we resist, it's more that we embrace it. So my breasts are hurting. Well, that's normal, you know, and just allow that.
But I do have data concern. Like as it is, if it's stored somewhere safe and it's only used for research purposes, it's fine. This is very cultured. Within the hospital
So our business model is based on donations from users and companies who support our mission to grow the community. And in the future, we envision to have user data as an additional revenue streams where selected third-party organizations will pay to conduct research with users who openly agree to share their data. So after the Atlas launch in 2022, we project to break even in 4 years, in 2026, with actually 50,000 active registered participants in the Atlas. But ALMA goes far beyond than this. So far, in the past 3 years, we've been developing a for-profit hardware-based product. At Cambridge University, we are developing a smart, innovative underwear that enables to detect early vaginal infection. Why? Through a user biosensor that is actually wearable in the underwear and that will measure the pH in vaginal fluids. So at this point, we've been earning like 200,000 euros from European and British grants, and we are looking for 300,000 euros to develop the beta version and launch the Atlas. We are a multidisciplinary team. We combine design, data science, and anthropology to co-create education and knowledge around female intimate care, while we leverage expertise in coding, engineering, and technology to develop our innovative products and smart technology. So ALMA is constantly growing. We are looking to partner and to connect with social impact investors who believe in our missions and with non-governmental organizations to grow the community, and together to create a cultural change in female intimate care. Thank you.
Thank you, good job. So can you talk a little bit about the relationship between the app and the underwear?
Sure. So basically, we started in 2018 by developing the sensor. So it was me as a designer and Thomas as a scientist. And we immediately understood that actually bringing a smart, innovative underwear in the market would have been quite difficult, not only from the technology point of view, as also Daniel before explained, but much more from the female point of view on how they will take and they will embed and they will wear maybe this underwear. So we are now growing the community, creating the knowledge and the awareness for then let the female accepting and actually then use possibly the underwear.
And can you talk about your monetization model?
Sure. So at the moment with the platform, we envision donation business model because we are non-profit, a social enterprise. So we are looking to collaborate and to create, like with the community, a sustainable support. While with the for-profit of the underwear, we will go to the normal stage of the investor path.
And when do you plan on having the underwear on the market?
So our scientists are starting now in September a postdoc to develop the sensor in a 2.0 stage. Later in the booth, you can see actually the wearable prototype we developed until now last year with Fraunhofer IZM in Berlin. And then we hope to arrive by the clinical trial at 2025.
And where do you believe the profits for your business will come from?
Well, we hope that from the underwear point of view, the profit will come from also like medical companies that will like to join us on the way, even though we know, of course, that bringing the smart, innovative underwear in the market will be quite challenging. Otherwise, we will already wear a smart T-shirt and other dress. So let's hope in 2025 already the vision of Daniel will be much more clear, actually.
Thank you very much. Julia?
Thank you.
From ALMA. Thank you. So up next we have Wavy Health, who I always love to hear of a startup that's looking to take on Headspace. It's such a massive and dominant company within the market, but does have many holes in its platform. Wavy Health is actually a deep technology for cardiac health and cardiac patients who are looking to reduce their stress levels. Welcome to the stage.
Hello everybody, my name is Steve, co-founder of Wavy, the smart partner for your heart. This is Anna, and when she was 45 years old, she was diagnosed with a heart disease, angina pectoris. And at that time, her life was extremely changing. And stress has a huge impact on her daily life, with tightness of chest, heart pain, and chest pain. And she is not alone. Because if we look into this specific heart disease only, there are more than 3 million people in Germany already. The problem is that treatment and therapy is based on physical fitness, and there is no evidence-based treatment available to retrain behavior. The good thing is that also cardiologists are now consider that stress is an important factor for treatment in cardiovascular disease. And last year, an important European guideline went out where stress is now also one of the 5 pillars for angina pectoris treatment. But the big question here is, how are we filling this gap? And that is exactly where Wavy comes in. We help heart patients to control and reduce stress by measuring individual stress and providing relaxation exercise. Wavy is a medical device app, and with our SDK, we can connect existing wearables like Garmin and Withings. And with this SDK, we can collecting biometric data in our application. Besides of that, we collecting quantitative data in our application. And with this data, we can make a personal stress profile from each individual user. The wonderful thing is that the patient get not only a good overview about the symptoms, but can also prepare better for the appointment with the cardiologist. This gives them a convenient feeling, but also save a lot of time for the cardiologist. But Wavy is much more than that, because we give not only an overview, but also help them to reduce stress. By our music therapy, the person can listen to any songs. And what we have done is we have built an AI filter that can change frequencies in the song. And that means that at every time, at every moment, the person can reduce their stress. The wonderful thing is that with Wavy, if you know how to use a music player, you already know how to use Wavy. And we are one of the first applications that focusing on mental health in cardiovascular disease. Our business model is a B2B2C model with a monthly subscription. And our goal is that it will be covered by the DIGA. To make that possible, we will get our ISO certification ready in November. And in February, we will start with our medical device trial with 2 German hospitals and the FAU. With this medical device trial, we can get our CE, and that means that in September, we can get approval for the DIGA and start the RCT. The market size is huge. Cardiovascular disease is a huge, huge market. And that means that Wavy can be used in every treatment in cardiovascular disease. For now, we are focusing on angina pectoris. And besides of that, Wavy can also be used for large organizations to reduce stress with employees. And next year, we will start our pilot with Novartis. The current situation is that we get already more than 450,000 euros in non-dilutive funding. Our app is testing in a clinical trial, and our application will be validated with 250 patients with 5 Dutch hospitals. We have a team with all the expertise to make this a success. We have expertise in AI, business, design, medical development, and audio. Together, we won more over than 40 international competitions. And the wonderful thing is that our company started after winning the TechWins Disrupt competition by Novartis in San Francisco. And look at this. This is where we have invested a lot of time in it. These are all our partners, hospitals, direct partners, and international partners. And also this year, we have invested in 2 international programs that we have joined and have learned a lot. The financial need is €1 million to make our goals happening. But the great thing is that we already have covered 400K by the public grants. That means that we are looking for an investment of €600,000. Besides of that, we are looking for cardiologists that want to join our RCT and patients and medical professionals, experts, that join our mission. In 2030, we want to help at least 1 million people. And it is time to disrupt the cardiovascular disease space and to make the bridge to mental health. Are you joining to make us the best partner for your heart? Come us at the booth and join. Thank you.
All right, let's dive right in. I think the most popular question was, where can I try it?
Where can I try it? Well, it is now testing in a clinical trial. And we're really testing with cardiovascular disease patients at this moment. And as I said, it will be also tested now in Germany. And hopefully then in September, everybody with the angina pectoris diagnosed can use it by the DIGA.
And is your solution also usable for patients with other stress-related diagnoses or even regular people suffering from stress?
Yeah, exactly. What we also focus now is, for example, on mental health. So some people are researching it already. And yeah, there's a lot of space in there to focus on, yeah.
And how do you intend to make yourself known to the cardiologists or the prescribers of the app versus drugs?
Well, I have to say that drugs will be always in there because we know that cardiovascular disease have always used drugs. So we also talk with pharmaceutical companies, but we really think that the combination of drugs and e-health can really make the patient to make it more efficient, but also convenient.
But how do you plan on marketing to the prescribers?
The marketing is that we're really working together with cardiologists. For example, we work with the most influential woman in the Netherlands in cardiovascular disease for women's health. And that means also with this traction, we really can focusing on patients and get attention.
Okay, and in just 20 seconds, what exactly is the medical clinical claim of your future medical device?
Well, the future is that we really can stress at every moment and can lower that stress as soon as possible. That is our mission. And do you have a patent? Yeah, we are really focusing on a patent now, so that's also something where we have invested now in.
Perfect.
Thank you so
Steve,
much.
thank you very much. Good work on the quick rounds. So, up next we have Nina from minime. Minime is an app that actually fills a really interesting space in the market that needs to be digitized, the one between the therapist and their patient. Someone who has a psychiatrist as a mother, I can definitely attest to the giant messy wall for a lot of her patient care. And it's really cool to see this company tackle an existing problem within this space. Nina?
Hi, I'm Nina, co-founder and full-stack developer of minime. Up until now, I've been to psychotherapy for more than 2 years, every week a session. But I'm not the only one. In 2018, in Germany, 3.2 million people consulted a therapist. And the numbers are still rising, especially in times like these. For a fact, you or your neighbor will consult a therapist at some point. So, how does behavioral therapy look like? Well, an important part of behavioral therapy is the conduction of homework between the sessions. For example, I was asked to track my emotions, thoughts, feelings, whenever I had time between the sessions. This happened on these paper logs in 2021. No wonder 60% of homework is not being completed. And it's not just me, but those paperworks don't fit any other patient's reality. Due to COVID-19, 70% of the therapists changed successfully to video therapy. Even after the pandemic, it's expected that video therapy and face-to-face treatment will often be combined. But holding my homework into the camera like this, it became super clear that those kind of paper logs are not just very old school, but also no longer possible to use. This is why we are creating minime, a digital collaboration toolbox for therapists and their patients. All important paper logs will be available online. So, how does it work? Well, first, an individual task or homework will be defined in the app during session. Afterwards, patients can now easily track events whenever they occur. Within the next session, those entries can be analyzed and the next steps can be defined together. My reality as a patient went from filling in this to entering the app and being able to decide whether I want to work on my own little minime or I want to jump into the timeline and see all the entries I've created so far. From here, I can easily add another entry, for example, to track my emotions and their intensity, and see them directly in my overview. Compared to paper logs, this is way more fun and motivating. I actually feel like I'm actively contributing towards my own healing. On the other hand, my therapist has a dashboard with all her patients on it. She can select one and see the entries that patient created so far. During session, the task of a therapist is usually to analyze the daily observations of patients between the sessions on those kind of flip charts. They are no longer necessary anymore. With minime, you get a detailed and well-structured overview of all the entries the patient has created so far. From here, the next steps can be defined. Minime is actually creating a higher impact and control for the therapist. It reduces prep time and paperwork. Minime is freeing up capacity. We developed our MVP closely together with the user feedback from patients and therapists. As a result, all experts confirmed now on the beta testing that minime can be used across all diagnoses with every patient because it's based on the core method of behavioral therapy. For a fact, we are the first and only interactive solution that is focusing the needs of therapists and patients at the same time. This is why we are targeting the therapist market with a B2B subscription model, which means we are not going through DIGA, but we can enter the market quickly. Tackling the international market and even the coaching industry provides us with even more opportunities. Within the last year, we have done all the steps. We secured a grant, we built the MVP, and we did the testing. So now it's time to enter the market in Germany and prove the concept. Within the next year, we'll have additional modules added, like a diagnostic feature. Parallel, we'll prepare the app for a fast-moving international rollout. Therefore, we are looking for 500,000 euros to do the marketing, triple the team size, and go to market. In 2023, we'll want to have 1,500 therapists onboarded into the app. Therefore, we are looking for smart money business angels and investors that have experience in our field. So, who will you be working with, and also, what's Minime's biggest advantage? Well, it's our interdisciplinary team. We have experience in UX, UI, marketing, business, and we have a therapist as a co-founder who has an extensive network. So, Minime is the first interactive therapy solution that solves actual problems for coaches.
Super sorry, but time is up.
That's fine, we are done.
Perfect. So do the therapists require training?
Actually, no, the therapists require no training at all. We know that therapy is not digitalized at all at the moment, so we are basing Minime on the actual methods therapists use right now, so they don't need any training, they can jump right into the app and they can start handing it over to their patients.
And how are you ensuring a safe data transfer between the transfer and the storage, where it's being stored?
You mean the
From
data?
the app to the storage?
Yeah, so our goal is to make Minime the safest app on the market, because from our interviews, we realized that data safety is very, very important for therapists, but also patients, especially when it comes to therapy and health data. We are having Minime according to all the GDPR guidelines, and we are making the data safety as our priority.
So what's the difference between you and your competitors?
Actually, all of our competitors are focusing on the patients. Usually they are lifestyle products, but we are focusing on the traditional therapy methods that are being used right now. So we believe in the face-to-face and the video therapy with one therapist. And we want to make those actual proven methods more digital. And that's the goal we have, and that's our biggest advantage.
And very quickly, how are you going to be marketing your product?
Exactly. So the marketing in Germany will be through our extensive network of therapists, through our co-founder, Paul. And it's mainly a B2B marketing with a very word-of-mouth approach, so very personal approach. We are already with hospitals. Yeah.
Thank you.
Thank you.
Okay. Good work. And so this is actually our last startup pitching for the day. It's already gone quite quickly. One of the things that I quite enjoyed from the keynote that happened earlier is that Daniel Kraft mentioned that video games are being used to treat ADHD, and this is one of the very interesting pieces of Karis. So David, thank you. Take the stage.
Hi everyone, my name is David, and I am the co-founder and CEO of Karis. We digitalize the therapeutic power of the arts. Arts have always been there for us. We have always used them to communicate all of those things that we cannot just put into words. But most importantly, arts also have a very strong therapeutic effect that you can use to improve your own mental health, as I learned on myself on April of last year. But this time, one of my best friends from my childhood had passed away because of COVID. And all of my family, comprised by doctors, was working day and night in hospital settings, bringing a huge amount of uncertainty into our daily lives. I was constantly overflown by emotions that I was not able to put properly into words until I decided to start painting them. In fact, this is one of the first paintings that I made during my lockdown. And I can tell you that it really helped me a lot to transcribe all of those feelings into something tangible. I also learned there is no right or wrong way of doing arts, as long as it is helping you to transcribe all of your emotions and to improve your overall mental health. So I started to wonder for myself if this could be useful for other people as well. And that is actually the case. With more than 900 scientific articles out there supporting the roles of arts for your mental health and well-being, it is clearly the point that arts could be useful not only for me, but for everyone who needs it. So we created a very strong but powerful team, comprised by our best of our knowledge in entrepreneurship, technology, and game development. And we put that in collaboration with our experts in psychology and creative psychotherapy. And with that, we created Karis. It is the first video game available in the market that is using the full power of the arts for you to work on your cognitive and your emotional abilities. In our game, you will be able to find different artistic scenarios that include as well guided painting sessions, co-designed by art therapists and creative psychotherapists, in which you will be able to reflect on your emotions by using paintings and eventually the power of the arts. Not only that, but you will also be able to see the results of your painting for you to reflect deeply into them. You could also use them to interact with your family, your friends, or with anyone who needs a little bit of support. And you could also even use them as part of live painting sessions, such as this one, in which you could interact with psychotherapists and mental health coaches. Apart from this, we have also created cognitive tasks that have been co-designed with psychologists and psychotherapists, in which you will be able to work on very particular cognitive traits, such as lack of focus, short-term memory, and decision-making. All of the parts and features that are included in our game have been thought for you to work on your cognitive and emotional abilities in an integral way, and for you to help you fully understand your potential as a human being. We have actually started to train and test our game with more than 20 potential customers, and they love it. They are starting to see how arts could actually help them in their particular lives, and they are urging us to bring this product into the market. And there are already very strong competitors out there, but we are the only ones that combine the full power of art therapy, communities, and psychology in a way that has not even been tried before. To do that, we are following a freemium business model in which everyone who needs it will be able to try the main core of our task for free, have access to personalized questions and group sessions, and even book personal sessions with mental health coaches and art therapists. We are looking for 200,000 euros for us to expand our team with marketing, game design, and game development, and to bring the therapeutic power of the arts into the market. Because for me, for example, it took a while, to help me fully understand the proper power of mental health. And it's time for other people to start realizing this power as well. There has never been a perfect time for you to join us and help us bring this symbiosis between arts, science, and people. Thank you.
Thank you. All right, so how do you measure the progress during gameplay?
Right now we are putting algorithms doing the game, and we are doing that in collaboration with our own network of psychologists and psychotherapists. And we are doing that based on the main core of our tasks that they are including as part of their live sessions. So we are actually starting to develop these algorithms by our own, and we will release that as part of our beta session by the second quarter of 2022.
And how big is the market?
The market is quite huge, actually. We have already seen a couple of hints from the slides of minime, but it is actually very big here in Berlin. If we are tackling, for example, young people from 15 years old to 35 years old, just in Berlin, that expenditure could be something between 15 billion euros, just in Berlin.
Amazing. Thank you so very much. Thank you. Good work. So I would like to take the time to thank all of the teams. You guys all did an extremely good job. All of your hard work and practice definitely paid off. So for all of you who are joining us online, thank you so much for taking the time to check out all of these pitches. And if you would like to get in touch with any of the startups, please visit the Vision Health website or on their LinkedIn page, and you can definitely find the contact info for all of the startups there. So for everyone online, thank you so much for joining us. Oh, yeah, you can clap, yeah.